So hello everyone, today we are making a pediatric physiotherapy assessment. First we'll write the anthropometric details. We'll write name, age, gender, expected date of delivery, birth weight, birth head circumference. Please make sure that you are well aware how to measure the circumference. Birth height, history. You'll take the antenatal history from the mother. You'll ask whether she take her supplements or not, how was the fetal movement, and when does the fetal movement actually started. Like in this case, in the 16th week of pregnancy, she started to have a fetal movement. Then whether she had any infection or not, like torch infection were there or not. Also you can ask for hypertension, gestational diabetes, any other changes which frequently occurs in the pregnancy. Then the natal history, duration of labor, then full term baby, preterm or the postterm. Whether the baby was born through a normal section or through a cesarean section. And also the position of the baby, whether he was cephalic or in a breech position. Complication, sometimes it happens when the baby born, there's the cord, it wraps around the neck. Then crying, whether the baby immediately started crying after the birth or he took minutes or he took time. Then whether the baby was in the NICU or not. Baby's first breastfed within 1 hour or how much he took the time. Then whether the sucking was proper or not. No history of jaundice, seizure or meningitis. Condition progressing, how is the condition, whether the baby is progressing or not. Then family history, like how many children she had before and all other things. Also please make sure you know how to make a consanguinitis. Then development history, gross motor, head control is there or not, and at what month baby has achieved the head control. Rolling supine to sideline, when does the baby achieved it. Rolling supine to prone, rolling prone to supine. Basically for all these movements you have to write down the amount of time he took to achieve all these things. Then fine motor, reach grab is achieved or not. Personal social, baby often smiles to the people, recognizes family members. So you have to also write down all these important factors. Then communication, like children means cooing sound, e sounds, whether the baby is making that sounds or not. Observation, you will notice whether the child is alert, playful, and what is the posture, like in the supine position, in the prone position, standing, and transition in the sense how long baby takes it to to come from supine position to a sideline position, to sideline to a prone position. Then examination, very important. You'll measure high cortisol functions, whether the baby is alert or recognize family members. Cranial nerve examination, most of the people are not aware that they have to go take a proper assessment of cranial nerves. So for the reflexes you'll check for the eye movements or the rooting, sucking and clenching of teeth, facial symmetry, gag reflex. Then sensory examination, awareness, response. Neuromuscular examination, musculoskeletal examination, whether is there any deformity or not. Cardiorespiratory, you should know how to auscultate a patient, especially baby, normal breathing rate is there or not. Then oromotor assessment, like tone of the oral musculature, like his tongue, like his oral cavity, you should be very well aware of that. Then other skills if required, you can evaluate. If you feel that something is missing or something is being suspicious, then you can go for other tests as well.